there's a condition that is called DVT for short, but it's called deep vein thrombosis. And it's a condition that has caused lots and lots of suffering. We heard that it sort of begins, it travels from the leg upwards, but that's just a rumor. And so we have the good doctor, Dr. Joel K Arhin from the Yeboah Hospital in East Legon, Accra, and he's here to help us understand what DVT is and what the causes are and how we can prevent them. Good morning, Dr. Arhin. Welcome to the show.
Good morning. Thank you.
Okay, and so what is deep vein thrombosis?
All right. So deep vein thrombosis, and so it basically means that there's formation of blood clots in the deep veins. Okay, and so normal anatomy makes us understand that in the venous system there's the superficial system and then the deep veins. And so when we talk about deep vein thrombosis, basically means that there's blood clots that has formed in the deeper veins of the venous system.
Okay, so where does the blood clot usually form? Where does it begin from?
So, I mean, it's important to know that most of the times when we talk about deep vein thrombosis, we focus on the lower extremities or the legs, but we must understand that clots can also form in the upper extremities as well. But most of the times, deep veins thrombosis occurs in the lower extremities. That is the legs or the thighs. Okay. So it forms in the veins, and then it has a likelihood of being complicated by being mobilized or moving from where it's being formed to the distal part of the body. So yes.
Okay. What factors would cause somebody to have a blood clot to form DVT? What factors would begin this?
All right. And so there's this triad called a virtuous triad. It was established by this German physician, he was also a pathologist, Rudolf Virchow. And then it summarizes the risk factors into 3 main risk factors. Okay. And so you have endothelial injury. I'll break them down. Then we have stasis, and then we have a hypercoagulable state. And so what happens is that the blood in its normal way has a way of preventing unnecessary clots from being forming. And then when there's a need for clots to form, that is when there's an injury or anything, the body, according to causes the clots to form appropriately. Now, this virtuous triad is a summary of all the factors that one way or the other affect how this normal blood clotting process happens. And so the first one has to do with endothelial injury. So endothelial injury is basically the blood vessels are lined by something we call endothelium. So it's more like the inner covering of the blood vessels. Okay. Now this endothelium has what we call prothrombotic and antithrombotic factors. I'm using big words. Prothrombotic means that it has a likelihood to cause clots to form. And then antithrombotic means that it has a likelihood to cause clots to dissolve. And so when the balance is lost, then we can have clots to form. So there are instances that causes endothelial injury to happen. Once there's endothelial injury, the factors that causes clots to form are activated, and then you start ending up having clots. So what are the examples of things that can make us have trauma? Maybe you have an accident, you break your bone, once there's any discontinuity in the lining of the skin, there's trauma. Then there's endothelial injury. Then these prothrombotic factors are activated. Also, IV cannulation.
Okay, so I'm even getting confused. Okay. So just break it down for us. Okay. What kind of injuries would cause somebody to have DVT? Simple. Yes, okay, so that we understand where. Yeah.
So trauma, any injury at all, motor accident, anything that will cause injury. Also, IV cannulation. Maybe when you go to the hospital and then you pass an IV line, it has a likelihood to also cause, because you go directly into the veins.
Okay, so in our setting, in our African setting, okay, when you say trauma, it means lots of things. So when you say trauma regarding DVT or injuries that lead to DVT, what exactly do you mean? Can you use another word for trauma? Thank you.
So let me say accidents, and then so road accidents and all these things that will cause a break in the skin are likely to predispose us to getting clots forming. And then also when you go to the hospital setting, you have a cannula, the IV line,
Right.
inside, because you are going right into the veins. You hit the veins, so that one also causes trauma to the veins. Also, incidences like cellulitis. When we say cellulitis, it means that there's inflammation of the skin, and then the
Right.
subcutaneous tissue also causes trauma to the vessels.
Okay, so if I'm getting you correctly, when we go to the hospitals and an IV line is inserted, you know, sometimes it sort of swells or reddens. Should we be alarmed? Because it
Yes,
happens a lot.
Yes.
Okay.
Yes, you're supposed to be alarmed. So it means that there's something called thrombophlebitis. So it means that the veins can
Another big word.
the veins can get swollen, and so sometimes when we ask you, do you feel pain? If the pain is unusual, we remove it.
Okay.
We remove it.
Okay, so I'm guessing now if we go to the hospital anywhere, especially for children or the others, please. So even if it's hurting and they are not asking, tell the nurse that it's hurting. Please take it out. Touche?
Yes.
Okay.
Okay. So I mentioned the first factor is the endothelial injury. The other risk factors is, we call it stasis. So stasis means that something is stagnant, is not moving.
Okay.
So what are some of the examples? Immobility, or someone being immobile. For example, somebody who has had stroke,
Right.
and cannot move the body and is just in bed all the time. Then you have the blood just sitting at one place and not moving.
Okay.
When it happens like that, you activate the systems that causes the blood to clot, and that happens. So people who have had strokes, people who are not really mobile because of conditions, people who have had surgeries and because of that have to stay in bed for a while.
Okay.
People who go on long flights, long distance travel. The books show that if you travel for more than 4 hours in a car or even an aeroplane, it puts you at risk of developing a clot.
Okay. How about if you sit for long hours?
Yes.
Say working.
Yes.
Okay.
Yes.
What would be the number of hours you would diagnose or you would recommend for someone?
So what we see most of the times is up to 4 hours.
Okay.
So you don't sit in a car. Maybe you're going from here to, say, the north,
Right.
and probably going to take more than 4 hours. It's advisable that at probably intervals, 4 hours, you stop, you take a break, the blood can properly circulate.
All right.
Same for us who do a lot of sitting. It's also advisable that from time to time we also get up and then do a lot of movement around.
Okay. And so when should a person be alarmed? When should we be alarmed and probably go to the hospital that I need to do a check?
Okay. All right. And so before I talk on that, one of the other risk factors are some people take oral contraceptives, obesity, alcohol, dehydration. All these things cause the blood to be, should I say, viscous or thicker, and so predisposes it to forming clots. And then there are also other disease conditions that genetically predisposes one to also form clots. So that is for that part.
Okay. Yeah. And so it is hereditary then?
There are some instances.
Okay.
There are some instances. And so when should you be alarmed? We have to note that sometimes DVT itself is symptomatic. So you might be silent. You may not feel any symptoms. But then what most people present to the hospital with is that they usually have unilateral leg swelling. That is swelling on one side of the leg. So it can be just the leg or the leg and the thighs.
Right.
Yes. And so the swelling...
Can you speak to this image on our screen?
Can I get the other picture if it's possible?
The first one, yes, we are going to pull it up shortly. Yeah. Right, comes back on. That's the first one.
This one. There was the one that had this one with the swollen leg. Yes, exactly.
Okay,
so once we see this picture, we see that there's a normal leg, then there's an abnormal leg. We realize that this leg is swollen, this leg is reddened, this leg is likely to be painful.
Right.
This leg is likely to be painful. And then when we examine it, we realize that once we touch the calf, it's likely to be tender. We use the word tender. Tender means that when we press it, we feel pain. That is the meaning of it.
Tender.
Yes. So you get alarmed once you have a unilateral leg swelling. That is swelling at one side of the leg, presenting with signs of redness. There's warmth. it's painful, and it's even likely to limit your range of movement.
Okay.
Some people might present with mild fever, and we have to note that some of these symptoms may mimic like cellulitis, which is just inflammation of the skin and subcutaneous tissues. So DVT can present this way, or DVT can present with both cellulitis and the DVT itself as well. And then there are some people that will not show any leg symptoms, but they'll go to the hospital suddenly with difficulty in breathing, because then at that point the DVT has been complicated by an embolus. So the clot has moved from the leg to the lungs, and then it's causing issues.
Okay. Do you have an idea how long it usually takes for it to travel from the leg up into the lungs?
Honestly, I don't. But I mean, certain studies show that usually there might be a clot there, but per movement and other things, the leg system is also some way shown to be like a heart, so it pumps.
Okay.
So once movement happens, like there's contraction, so there's likelihood of the clot being moved from the leg up.
Okay, so the instances that we've heard of people dying from DVT, where they say there was a blood clot somewhere and they died, does it mean that when it started they did not feel pain, they didn't feel anything, and it just traveled up? How does that happen?
So that's what I said. So some of the DVTs, the symptoms are silent. You may not note. There are other people who are quite reluctant in seeking medical care. They sit in the house, do a lot of other treatments, seek medical care early, and then only present when things get worse. Yes. However, there are also other people that the DVT is quite silent,
Right.
and so they probably may not have taken note of it. Before you realize that the clot has embolized, gets a PE, and trouble.
Okay, so can more than one clot form?
Yes, more than one clot can form.
Wow.
More than one clot can
And
form.
in those cases, what? Assuming we are using the image of the swollen leg, so in those cases where there are two clots, do both legs become inflamed or swollen or red?
Okay, so as I said, the most common symptoms is usually unilateral, one-sided leg
Right.
swelling. But some people also present with two-sided leg swellings. So once you have, and then what might make it difficult in such instances is that when people present with two-sided leg swellings, we are thinking of something more systemic. Is it a heart problem? Is it a kidney problem? Is it a liver problem? And so sometimes you need a very high index of suspicion to fish and say that no, this might be more than a heart or liver problem. It might be DVT affecting both sides. Because I think there was one time I had a client who, I think a 63-year-old man who came, but he had DVT of both lower limbs, from the legs to the thighs, all swollen. So even though most of the times it's one-sided, there are times that you might have both-sided also having clots.
Okay, so are there particular blood groups that are more likely to develop blood clots?
For that, it's not something that I've really seen anywhere. Yes, so for that I can't say much about it.
Okay, so now let's talk about treatment.
Okay.
First, is there a herbal way to treat this?
Oh, I wouldn't want to say no, but since practice, I've not come across any herbal way to treat it, and we usually wouldn't recommend that. We'd want you to come and then get evaluated, and they will treat you the appropriate way.
Okay, so let's talk about treatment.
Yes.
How do you go about treatment?
Okay. And so by way of treatment, and the most common way of treatment is using drugs called anticoagulants.
All right.
We might simply call them blood thinners.
Okay.
So it thins the blood. What anticoagulants do is that it does not dissolve the old clot, but what happens is that it prevents new clots from forming. It prevents the old clot from becoming bigger, and then as it does this, the body uses its own natural mechanisms to lyse the old clot that is there. So that is one. So that's the anticoagulant.
Right.
And then there's also fibrinolysis or thrombolysis, which is also medical. That one which dissolves the clot. But then these ones have their side effects. The medications can be quite dangerous because you are giving medications that is going to thin the blood. So there's a risk of bleeding. And so you weigh the risk and the benefit and you give it appropriately. And then there's also surgical ways of managing it.
Okay.
That is usually used in people that the medical ways are contraindicated or cannot have the medical because of maybe they have a higher risk of bleeding. And so maybe you might have to surgically pass a stent, surgically go in through a catheter and then lyse the clot, or you may have to surgically remove it. There are other people that also, we can place vena cava filters.
Okay.
It's like, should I say a mesh?
Okay.
You put it at the level of the inferior vena cava. The inferior vena cava is the end point of where all the veins drain to.
Okay.
So once you put the mesh there, then if there's any clot, it prevents it from moving up. So those are basically
the basic things. Okay. How often do people come with DVT, or how often do you diagnose people with DVT?
I think I don't want to say it's seasonal, because sometimes once you start seeing certain things, you see it for a trend and it dies down, and then you see it again.
Okay.
So I mean, it's quite often. It's quite often. I think the past 2 months I've seen 2 cases of DVT. 2 cases of DVT. So I would say it's quite often.
Okay. Are there certain foods to eat so that we naturally thin our blood? Is that even advisable to just do stuff or take medication to thin your blood?
Naturally, no.
Okay.
No, they are not certain foods that or drugs or anything that's naturally required to, because the body in its own has its own mechanisms to do that. And so if you want to do something like that, you're likely going to predispose or put yourself at risk of more bleeding. And so usually it's not really advisable. However, for people who are high risk and people who are at risk of developing DVT, there are certain mechanisms or certain preventive measures that are required to be put in place for such people.
Okay, and so we are active on our WhatsApp 05561034, and Maltiti Saida Sadiq is at the interactive screen, and she'll read some messages and probably some questions. Doc, Maltiti.
Thank you so much, Doc, for breaking it down. Before I handed over to Val, I was like, DVT, deep vein thrombosis, what's all this about? And I heard Val say the name sounds complex. But maybe you would say later if people say you're too young to be a doctor when they come to the hospital for treatment. But our viewers are saying, Gilbert Dunu says that, do we have any risk of DVT when we have interrupted sleep for 6 hours? Accra is sending in that question. Another viewer says, even though I'm a health worker, I never miss the health segment. I always get to learn something new from the experts. You guys are doing a great job. Messi is Siedua is that viewer. One says, please, how does one stay fit and prevent getting this condition? Is wearing of heels a factor too? Hashtag GTV breakfast. Is wearing of high heels, we in this profession will be caught in that.
Okay, so Doc, you want to address these questions?
Okay, so the first one.
Well, did you want to go up on the first one?
Yeah, so the first one said, do you have any risk? Do we have any risk of DVT when we have interrupted sleep for 6 hours? Okay,
so for that, I mean, per my studies, I've not come across anything of having interrupted sleep. Yes, but the point is, if you are not sleeping, what are you doing? Because most people who do not sleep are either sitting for long hours, not moving, and all these things. So I think that it more has to do with what you do when you are not sleeping. Yes.
Okay. Yes. So what would you advise we do when we are not sleeping? For somebody who is high risk. So
as I said early on, for the high risk people, we usually do preventive. So we have compressive stockings, test stockings that you can wear, yes, so that to prevent clots from staying there. And then also, if you know you're high risk, then if you are going to be sitting, don't sit for too long. At least have a take frequent breaks, walk around. Also, make sure you are well hydrated. Drink a lot of water, because dehydration also puts you at risk of forming clots, because the blood ends up becoming more viscous and then has a tendency of forming clots.
Okay, and
there was a question about high heels.
The high heels, yes.
There was one before, I think something for the high heels. The same person, but the
same person. This one talked about this one is the high heels. The other one talked about the program, and the other one talked about
The
the
high heat.
interrupted sleep.
Yes, one also spoke about exercising. Yes.
And so I think the person's talking about the preventive measures and then
Yes,
all
there's an
that,
exercise
yes,
questioning.
yes.
Please, I want to know what exercise can help to, can help to prevent DVT, the person is asking.
So I think that once you are exercising, you are an active person. You are not a dull person. You are not just sitting at one place. And so once you exercise, it helps blood to clot. As I said early on, the muscles of the calf, as they contract and relax, it causes the blood to move from the veins up to the heart. And so exercise also helps in blood circulation and prevents stasis from happening.
Okay, and so in rounding up, what would you say to viewers who are watching, people who are at high risk, people who are not at high risk, and just generally keep safe?
Okay, and so I would say that DVT is common, is real, and we must be cautious of this disease. For most of us who are quite sedentary in our lifestyles, those of us who do a lot of sitting, it's advisable that we don't do a lot of sitting. At least get up, do a lot of walking around, stay well hydrated. If you are doing long distance journeys, either by car or flights, it's advisable that for at least 4 hours you stop the car and then at least move around, stretch your limbs. If you're in an aeroplane, if it's safe, you can get up, walk around, use the washroom, and then through all this, you have to stay hydrated. Also, it's advisable that if you are high risk and in such conditions, you avoid alcohol, because alcohol in itself can lead to dehydration. Yes.
Instead of drinking alcohol, please drink lots of water. And we've had an amazing conversation with a specialist physician, Dr. K Arhin from the Yeboah Hospital. He's been telling us all we need to know about DVT. Still to come, there's headlines with Dr. Odro Osai and Chief Yao Anochi from Pong. That'll be a sit down with CAF to discuss what's trending in the newspapers online. Also, we'll be switching over to